Hello, in this video, I'm going to tell you all about disc herniation and disc protrusion. So first, a quick lesson on intervertebral discs. So an intervertebral disc is a tough structure that is located between each pair of vertebrae. Its job is to cushion between the vertebrae and provide shock absorption and increased range of motion of the spine. We have 23 altogether, and each one is made up of two parts. The annulus fibrosus, that's this outer part. It's tough and rubbery and really dense and fibrous. And then the nucleus pulposus is kind of the pulpy inside. So it's kind of the soft, gooey, semi-gelatinous, very flexible inside. So it's kind of like a big jelly donut, where we've got the donut part and the jelly inside. So what is herniation and protrusion? So really protrusion is one of the phases of disc herniation, but I'll get to that in a couple of slides from now. But disc protrusion is commonly referred to as a bulging disc. It's when the nucleus pulposus, so the gooey jelly inside, starts bulging into the annulus fibrosus, the donut part, but it doesn't bulge enough that it breaks through. So it causes a distension or bulging of the annulus fibrosus, and that bulging can impinge the spinal nerves or the spinal cord for that matter, but it's still contained, the jelly is still contained inside the jelly donut. It's just misshapen now, so it's it can be pressing on the spinal cord or the nerve roots, and that's what we see in this picture in the center here. Disc herniation is the same process, but after the nucleus pulposus has broken through. So now the jelly is squirting out of the donut. So the nucleus pulposus breaks through the annulus fibrosus. So it causes a distension or bulging of the annulus fibrosus that can cause impingement. So exactly the same as the disc protrusion. But in this case, the nucleus pulposus is not contained and it can leave the intervertebral space. Okay, so it's herniated, it's broken through, and still can cause that same kind of nerve compression or spinal cord compression, but now it's can be leaking out. So signs and symptoms. First, it depends on at what level the herniation is taking place. So where the signs and symptoms are occurring will depend on that level. So if it's happening in the neck, then it's going to cause problems in the upper extremities. If it's happening in the lumbar spine, then it's going to cause symptoms in the lower extremities. So they can be completely asymptomatic, because imagine the bulge is happening in some part of the disc where the spinal nerves are not, and where it's not happening in the direction of the spinal cord. So it could happen without touching anything, and it might not hurt at all. But if it does press on the spinal cord or the nerve roots, then it can cause pain, numbness, or tingling in whichever extremities, depending on the level of the herniation. And then it also can cause weakness of muscles that are supplied by the affected nerve. So if it is impinging nerve root, then it can affect whatever structures are supplied by those nerves that are leaving the spinal cord. So how does this happen? In most cases, most often it's caused by age-related wear and tear, so disc degeneration. So the discs are breaking down gradually over time due to wear and tear, and it could be normal or abnormal wear and tear, so like too much and lifting incorrectly and that sort of thing. It can also be caused by a single acute event, so some kind of traumatic event like falling, a car accident, an athletic accident. But that's not common. Most often it develops gradually over time due to degeneration. But there are some risk factors that some that we can control and some that we can't. But there are risk factors that make us more prone to disc herniation. So the first is weight. If we have excess body weight, that increases the amount of stress on the spine and increases the likelihood of a disc injury. Occupation. So if somebody has a very physically demanding job and they're doing a lot of repetitive lifting, pulling, twisting, those sorts of movements, and they're doing it repetitively, and especially if it's under a lot of weight, like if it's weight bearing and they're lifting heavy things, then they might be more prone. Genetics, unfortunately, some people are just more predisposed to disc problems than others. Smoking. So smoking can reduce the oxygen supply to the discs, and reducing the oxygen supply can cause the discs to degenerate more quickly and make them more prone to herniation. Somebody who drives a lot, so that could be for work, like maybe a truck driver, delivery driver, or it could just be somebody who drives a lot. You have a long commute or whatever it might be, because being seated for long periods of time is already kind of strenuous on your spine, but combine that with the vibration of the vehicle that you're driving, and it really puts a lot of stress on the discs. And then finally, being sedentary. So regular exercise helps to prevent disc injury. So be active and move around. That's going to help you. If the more stationary you are, the more your discs sort of lose their flexibility and makes them more prone to rupture. All right, so severity. So as I mentioned, protrusion is sort of a stage of herniation. So there are 4 stages depending on the severity. So stage 1 would be a disc bulging or disc degeneration. So in that case, there's sort of symmetrical flattening of the disc in all directions. So it's like we have our jelly donut and there's too much force being applied and it's just kind of squishing it. So it's becoming thinner and more squished out in all directions. Disc protrusion is if we have a bulge of the nucleus pulposus into the annulus fibrosus, but the annulus fibrosus is not ruptured. So that's like what I described earlier as a bulging disc is commonly what we refer to it as. So in that case, we've gone past just the flattening stage, and now there's some of the jelly kind of squishing into the jelly donut in one direction, but it hasn't broken through yet. Disc extrusion is when there finally is a rupture. So the disc has finally herniated at that point, because the hernia means that there's some barrier that has broken and allowed something that it was containing to break through. So a hernia, we have hernias in all sorts of places in the body. In this case, a disc herniation, it just means that sort of boundary has ruptured, and now whatever it was containing, in this case, the nucleus pulposus, is allowed to break through. Disc sequestration is when we've had that bulge or we've had that herniation and the nucleus pulposus escapes, but now if it completely detaches, so like it squirts out, and now if it breaks off and travels somewhere else, now that's a disc sequestration. All right, so treatment and healing. In most cases, disc herniation improves gradually over time without surgery. So the herniation itself isn't really going to go away, but the symptoms do tend to ease significantly, especially with like physical therapy. So you do muscle strengthening, stretching, traction, massage, all sorts of modalities that they'll do with you. So those things all help a lot, and so it usually gradually improves over time. Now, importantly, if you have a disc herniation, you want to maintain your level of activity that doesn't cause pain, but you don't want to be sedentary. Okay, so having a disc injury is not a good reason to just sit around and not do anything anymore. That's going to make it worse. So if you want it to gradually improve over time, you need to maintain your activity. You need to exercise and move around and walk and do whatever you can, but at a level below where it causes pain. So that's kind of a tricky thing, especially in the very beginning where everything you do causes pain. So if that's the case, then rest. But don't let it go too far. If you are able to get up and walk and do things, then you should. Okay, so get as much activity as you can short of what is causing pain. And then gradually over time, that level of activity is going to increase and increase until hopefully you'll get close to back to normal, if not completely back to normal. You might also try anti-inflammatory medications, and that could be over the counter, or they might prescribe a stronger strength for you. Pain medications and muscle relaxants might also be prescribed. They might be helpful. They might do an epidural steroid injection. So, yeah, that could be helpful. If you've watched my videos, you probably know I'm not a huge fan of steroid injections because they do kind of weaken bone, and in this case, that's the last thing you want. But sometimes you do what you have to get through the pain and to help yourself get better. So if that's what you need, go for it. And then, as I mentioned, physical therapy can be really useful, and they'll apply many different modalities with you and help you return back to your normal function. Now, surgery might be recommended in certain cases. So, like if you're doing everything I just discussed and you're in so much pain that it's limiting your activity or your quality of life, then surgery might be appropriate. If you have neurological deficits that worsen, so like muscle weakness or numbness, and it's getting worse instead of better. If you have loss of bowel or bladder function, difficulty standing or walking, and if your condition is just unbearable and none of the conservative treatments are helping, then it might be time to consider surgery. All right, well, thank you so much for watching this video, and I'll see you in the next one.